6 key signs you shouldn't ignore. Have you ever wondered if those little changes in an aging loved one, like skipping meals more often or dozing off in the middle of the day, might actually be early signals of something far more significant? You're not alone. In a fast-paced world like ours, especially here in the United States, we're often so busy juggling work, family, and other commitments that we fail to notice our elders quietly sending out distress signals. Then, when a sudden health crisis happens, it feels like it came out of nowhere. But the truth is, the end of life is rarely instantaneous. Our bodies, even in old age, usually give us warning signs, sometimes months or even a full year in advance. In today's video, I'm going to walk you through 6 key indicators that often show up before an older adult reaches the final stage of life. Now, these signs don't mean that death is imminent tomorrow, and they're not meant to replace professional medical advice. Rather, these clues can help you be more aware of what's truly happening so that you can provide better support, plan ahead, and focus on meaningful moments. If you've ever felt caught off guard, or if you simply want to ensure you're ready when that time comes, stick around. By the end of this video, you'll have a clearer understanding of what to look for, how to respond, and why these signs can matter so much in the final chapter of a loved one's journey. Let's get started. Number 1. Notable weight loss and lack of appetite. One of the most revealing red flags that often appears months before the final stage of life is a steady loss of weight, especially when no one's trying to lose any. Maybe your mom has always loved that famous chicken pot pie recipe, but now she barely touches it. Or your granddad, who used to demolish a plate of burgers at the family cookout, suddenly leaves half his meal untouched. Sometimes it's subtle at first. A tightening belt loop, a bit of sag around the cheeks, or a favorite sweater that now looks baggy. In many cases, families chalk it up to they're just getting older. But a lack of appetite and unintentional weight loss can mean the body is no longer absorbing nutrients, as it should, and muscle mass starts to drop. It's like the body is quietly signaling, I can't keep up the way I used to. What's tricky is that aging does cause some decrease in muscle and strength over time, so you might assume it's normal. But if it happens too quickly or you notice meals being skipped more often, pay attention. Sometimes the digestive system is slowing down or not breaking down nutrients as effectively. Other times, the individual's sense of taste changes. Foods they once enjoyed no longer hold any appeal. You might try serving all their favorite dishes, only to watch them push the plate away. There could also be an underlying health condition. Anything from heart disease and kidney issues to depression or certain forms of cancer, all of which can quietly progress before more obvious symptoms show up. For those of us living in the US, we sometimes think an extra protein shake or a special diet will fix this problem. And sure, it can help to offer smoothies, easy-to-chew foods, or frequent small meals. But if the weight continues to drop despite your best efforts, it may be a deeper transition the body is undertaking. If you're seeing your loved one becoming weaker, eating less, and losing weight, consider it a cue to have a thoughtful conversation with healthcare providers. This is the moment to recognize that something significant is happening beneath the surface. Rather than forcing large meals, focus on the comfort factor. Small, nutrient-rich snacks, plenty of liquids, and a relaxed atmosphere. When you catch this warning sign early, it offers a window to plan end-of-life care with clarity and compassion, making every remaining moment count. Number 2. Deep fatigue and noticeable weakness. Before we dive in, I want to pause for a quick check-in. If you're still watching and finding these insights helpful, drop a comment that says number 2 below. And if you haven't already subscribed, please do. Your support allows us to keep making valuable content like this. Now let's talk about the second sign, a profound level of tiredness that doesn't improve with rest. This isn't your typical end-of-the-day fatigue. Instead, it's an overwhelming exhaustion where simple tasks, like getting dressed or making a cup of coffee, feel monumental. You might notice your loved one needing multiple naps throughout the day, or having difficulty staying awake even during their favorite TV shows. If you suggest going for a short walk, they may look at you like you're asking them to climb a mountain. Why does this happen? As the body's organs begin to wear down, circulation is compromised, making it harder to deliver oxygen and nutrients to muscles. The heart doesn't pump as powerfully, so each step can be a struggle. There's also a metabolic slowdown. Energy that once went to movement and tasks is now rerouted. The body seems to say, conserve what's left. Focus on essential functions. In an American setting, where independence is highly valued, it can be heartbreaking and frustrating to see a once active parent suddenly unable to do the things they love. They might feel guilty or embarrassed about needing help for everyday tasks, which can lead them to withdraw from social activities. This can spiral into isolation, compounding both physical and emotional decline. Pushing them to just get some exercise or tough it out usually doesn't help and might make them feel worse. Instead, it's vital to respect these new limits. Offer support. Arrange for home health visits if possible, and prioritize the quality of each day over the quantity of tasks done. The key is understanding that this fatigue is part of a larger transition, not just laziness or a lack of motivation. Meeting them where they are, physically and emotionally, can go a long way in maintaining dignity and comfort. Number 3, cognitive confusion or emotional withdrawal. In the United States, we often see commercials for memory care facilities or senior living communities, emphasizing how older adults can stay sharp well into their golden years. However, if you start noticing a loved one becoming disoriented in familiar places, forgetting basic details, or losing track of conversations they once followed easily, it might indicate more than just age-related forgetfulness. Sometimes it shows up as mild confusion, like mixing up dates and times or repeating the same question multiple times in one conversation. Other times, it's more severe, such as not recognizing close family members or feeling lost in the house they've lived in for decades. In some situations, emotional withdrawal is more apparent than memory lapses. Maybe your once chatty aunt barely speaks up during family gatherings, or your grandfather stops watching the sports he used to obsess over. It could be that talking and processing emotions have become too draining. The brain, just like the rest of the body, is getting less blood flow and oxygen, causing both cognitive and emotional shifts. Some people experience abrupt mood swings, irritability, sudden anxiety, or even moments of tearful confusion, while others seem eerily calm or indifferent. From a caregiver standpoint, this can be one of the hardest changes to witness. The person you've known all your life now seems distant, like they're living in a separate reality. But it's crucial to remember that these shifts aren't a choice. They're a natural part of the body's gradual shutdown. Instead of trying to force them to snap out of it, meet them with gentle reassurance. Keep your tone calm, avoid chaotic environments, and offer simple, direct conversations. If they only have the energy for a few words, let that be enough. Sometimes just holding their hand or sitting quietly beside them can communicate more love than any long conversation. This gentle approach helps create a safe, comforting space, which is especially important in their final chapter of life. Number 4, more frequent infections and slower healing. Still with me? If you are, comment number 4 below to let me know you're tuned in. Don't forget to subscribe and turn on notifications so you won't miss any of our future videos designed to inform and inspire you. Now let's tackle another common sign: a weakened immune system that leads to frequent infections and slower healing. Ever notice how small scrapes or cuts that used to heal in a couple of days now linger for weeks? Or how your loved one seems to catch colds, coughs, or get urinary tract infections over and over again? In the US, where many people have access to antibiotics and various medical interventions, it's tempting to think, we can just get another prescription. But as the body nears the end of life, even strong medications may lose their effectiveness. The heart isn't pumping as vigorously, circulation slows, and essential nutrients don't reach tissues as efficiently, making recovery a drawn-out process. Pressure sores can also become a pressing concern if your loved one is bedridden or spends a lot of time sitting. These sores can escalate quickly into more serious wounds if circulation is poor. And sometimes an infection shows up in unexpected ways, like increased confusion or sudden weakness, rather than a high fever or intense pain. Family members might interpret it as just another bad day, unaware that a hidden infection is raging inside. At this stage, aggressive treatments can become more taxing than beneficial, causing repeated hospital stays and exhausting the individual's already limited energy. That's why many families eventually choose hospice care or palliative services, focusing on comfort rather than cure. It's not about giving up, but about shifting priorities. Hydration, cleanliness, gentle wound care, and emotional support can often offer more relief than another hospital-based intervention that saps what little vitality remains. If you notice a pattern of infections or sores that won't heal, take it seriously. This is the body's way of telling you it's no longer equipped to fight back as it once did. Number 5. Changes in breathing and circulation. Shallow breathing, irregular breathing rhythms, or pauses between breaths. These can be alarming if you're not prepared. You might observe what medical professionals refer to as Cheney-Stokes respiration, where breathing speeds up, then suddenly slows to a near stop, only to start again. It can be unsettling to witness, prompting many families to rush their loved one to the emergency room. However, this pattern often emerges because the body's systems are winding down. Likewise, circulation issues become more pronounced. Hands, feet, and even the tip of the nose might feel unusually cold. The skin can take on a bluish or mottled tint, particularly in the extremities. This happens because the heart is directing blood flow to vital organs, leaving less for the limbs. Some people also become short of breath doing the simplest tasks, like shifting position in bed or talking at length. If fluid accumulates in the lungs, you might hear a gurgling or rattling sound, commonly called the death rattle, though it can start weeks before the actual final moments. Here in America, it's common for loved ones to feel a surge of anxiety, worried that they need to call 911. And if there's immediate distress, definitely don't hesitate to seek medical guidance. But often, these breathing changes are a natural part of the end-of-life process. Using additional oxygen or medication to ease respiratory discomfort can help. But the bigger goal is comfort, not necessarily prolonging life by any means possible. Consider raising the head of the bed or using extra pillows if lying flat is too difficult. Gentle reassurance, a calm environment, and soft lighting can all make this stage less frightening for everyone involved. Number 6. Decline in personal grooming and self-care. I wanted to add this final point because it's something that many families in the US notice early on, but rarely recognize as a potential end-of-life indicator. Perhaps you've seen your loved one skipping their usual morning shower or neglecting basic tasks like brushing their teeth, combing their hair, or changing into fresh clothes. It's easy to assume they're just feeling a little down or forgetful. But often, these hygiene lapses are due to a decline in both physical and mental energy. They may find the bathroom too far away, the water too cold, or the act of reaching for shampoo too physically draining. This decline in self-care can also coincide with diminished interest in social events or public outings, partly because they're self-conscious about their appearance, but also because the energy required to present themselves as they once did simply isn't there anymore. Over time, this pattern can spiral. The less they groom, the more they withdraw, and the more they withdraw, the less motivated they are to maintain personal hygiene. As with the previous signs, it's vital to respond with sensitivity. Instead of criticizing them for not caring about how they look, offer gentle assistance. Maybe suggest a warm sponge bath if a full shower is too exhausting, or help them wash their hair in a more accessible setting, like a kitchen sink with a handheld sprayer. In some American households, home care aides or visiting nurses can assist with personal grooming, ensuring that dignity is preserved. Recognizing this as a sign of deeper decline allows you to step in compassionately, rather than waiting for the situation to deteriorate. Conclusion. We've covered 6 major signs that often appear in the months, or even up to a year before an elderly individual passes away. 1. Noticeable weight loss and reduced appetite. 2. Deep fatigue and weakness. 3. Cognitive confusion or emotional withdrawal. 4. Frequent infections and slower healing. 5. Changes in breathing and circulation. 6. Decline in personal grooming and self-care. No single sign guarantees that the end is near, and not everyone experiences all of them. However, if you start observing multiple signs simultaneously, especially if they worsen over time, it's likely your loved one is entering life's final stage. It can be a tough reality to face. As Americans, we often lean on medical interventions, hoping for last-minute cures. Sometimes treatments do help, but other times they only prolong discomfort. By understanding these signs, you can make a more informed decision about prioritizing comfort, dignity, and emotional connection over aggressive medical measures that might not significantly change the outcome. Now, as you reflect on everything we've covered, take a moment to breathe and remember you're not alone in this journey. Many families struggle with these questions every day. What's crucial is that you're here, learning, and taking steps to ensure your loved one's final chapter is marked by respect and compassion, rather than uncertainty and regret. If you see these signs happening, consider talking to your healthcare team about hospice or palliative care options, or even seeking out counseling resources for yourself and other family members. These services are designed to provide comfort, support, and guidance during this challenging season. Thank you so much for watching and being part of this community. If you found value in this video, please like, comment, and subscribe. Share your thoughts below. Let us know one thing you learned today and how you plan to apply it. Reading your comments motivates us to continue creating meaningful content that helps you navigate life's most important moments. We appreciate your support, and we look forward to seeing you in our next video. Until then, remember, in the face of life's toughest transitions, knowledge and compassion can make all the difference.